Welcome, my name is Paul Donohue and this is Dollars and Cents. Today we focus on the healthcare industry, a massive industry with tremendous impacts in our local community, generating well over $100 million in annual payroll, more than 7,000 jobs, hundreds more in millions of dollars in commercial impact for construction jobs and business services. We're going to talk to some healthcare professionals, folks that are in the trenches in the healthcare industry, to get their take on, frankly, the transformational changes that are occurring in that industry. You know, so often we hear from politicians and pundits and folks about what's happening in healthcare, but it's very rare that we actually hear from the folks that are every day providing care to you, the patients that they see. So it should be an interesting program with some direct connections to Parkland College. So we're delighted you're here. Welcome to the next edition of Dollars and Cents.
In the last 10 years, Parkland Baseball has sent 97 players on to four-year schools on baseball scholarships. We've made 5 appearances in the World Series. We have won 2 national titles, produced 3 Major League Baseball players.
I came here on a Parkland Baseball scholarship, and then I found the career that I want to go into, criminal justice. Playing sports, a lot of fun and keeps you busy.
Colin's a very dedicated player. He's got some schools that are coming out to determine how much scholarship they can offer him.
Welcome back to Dollars and Cents. Today, the focus of the program is the healthcare industry. You know, we have, just phenomenal healthcare resources in our Champaign County regional economy. And one of those resources and one of the quality practitioners is joining us today on Dollars and Cents, Dr. Doug Jones. Welcome to Dollars and Cents, Doc.
Hey, thanks for having me.
Great to have you. Dr. Jones is board certified in surgery. So when it comes to practicing medicine, you're sort of at the top of the food chain. Wouldn't you be? Surgery, general surgery?
Well, we're all very, very important. You're trying to get me in trouble with my colleagues.
No, you're all good. He's a terrific person. I enjoy kidding him, and he's one of those individuals that he has a terrific personality. They would say great bedside manner. But just in terms of his education, Virginia Tech University.
Virginia Tech.
Morehouse School of Medicine, Atlanta,
Correct.
Georgia.
Correct.
And a residency at Cleveland Clinic in Cleveland.
Correct. I know everybody here in Champaign, they love Mayo Clinic, but it's a very good healthcare system called Cleveland Clinic in Cleveland.
Well, I think people are also familiar with Cleveland Clinic as well, Doctor. What are the distinctions? What is the separation, do you think, between a Mayo Cleveland Clinic and any other healthcare institution?
Well, when you get to that level, there's not much of a difference because typically both of those institutions are always top 5 in the whole country. And by definition of being the whole country is usually one of the top in the world. So a lot of people think the United States have the best healthcare when you look at the actual institutions of what they offer. So they're both pretty equal. It's just one's in Minnesota and the other one's in Cleveland. And of course, since I finished residency in Cleveland, I'm gonna get the head nod to the Cleveland Clinic. But no, the big thing with Cleveland Clinic is it's the #1 heart hospital all the time. And so we get a lot of heart patients and things. And then all the other subspecialties are very good and support that as well.
Been in this community for about 10 years, practicing medicine, performing surgeries. Just give us some insight about this marketplace and what you like about this community and practicing medicine here.
Well, medicine in this community is extremely good. When you look at a place where the population is about 120,000, you usually do not have a facility or facilities like we have here. Now, you do have one exception because I just, been to Rochester, Minnesota, and they actually had the Mayo Clinic, and their community is about this size. So that's kind of that's an anomaly right there. But this is a great healthcare system. I think having 2 different institutions, basically from a hospital standpoint, you have Presence Covenant Medical Center, and you also have Carl. They keep each other on their toes. And then from the actual providers, you have Christie Clinic and you have Carl, and they keep each other on their toes. So I think it's excellent in that fashion.
Well, what's interesting about the business of medicine, too, that people may not realize this, is that you're essentially contracting for surgical facilities when you're
Correct.
performing medicine. You don't
Correct.
actually work for the hospitals, you work for the clinic.
Correct.
But you utilize the surgical facilities at both institutions or have privileges there. And,
Correct.
and what's that dynamic like? You know, the hospital wants you to come there to do your surgeries, you get to pick and choose, or, you know, what are you looking for there when you're practicing?
We do a majority of our operations at present, Covenant Medical Center, and we also operate at Carl. And I actually do a few even at Kirby Medical Center in Monticello. Now, the thing is, of course, we're able to get more time and admit more patients and do more things at present Covenant Medical Center just because we have more beds available to us and more OR time. And it's in our best interest to go to the place that we, of course, accommodate us the most. So, you know, it's a little harder for Carl just because they have their own providers and they're extremely large and they have to, you know, make sure that they're taken care of as well. But I think all three facilities do a great job at, you know, making themselves available to us.
So much in the news about healthcare today. We had the Affordable Care Act that was passed last year. It survived a Supreme Court challenge. The rollout is happening currently.
Correct.
Nobody really knows yet what all of the ramifications are going to be, but just from your perspective, doctor, you know, what do you see or what are the factors that you're paying attention to as this new legislation rolls out?
Okay. Now, at this current time, you made a good point. I'm going to speak as a provider. I'm not speaking on behalf of Christie or any other hospitals. I think it's gotten to a point where everybody wants to do what's best and still be successful in all that means. We want to be successful providing for our families. We want to be successful in taking the best care possible of our patients and making sure they have the best outcomes. And now, you know, the resources are a little more limited. So how do you make all that work? I feel there's a lot of good things that's going to come out of this in the fact that we're going to try to decrease waste. We're going to try to be more efficient. And I think that's going to be great for the patients. What you're getting a little pushback from the providers is change.
Right.
You know, it's human nature. You know, change is hard. And we have a lot of change going on at one time. And we'll just have to wait through and see how it comes out. I cannot tell you exactly how it's going to go.
Talk about another aspect of change that we're noticing in the industry, and that's technology.
Correct.
Give us a comparison today with the level of technology that you have available as a surgeon compared to the year that you came out of residency and started. Has there been a lot of change just in terms of the technological ability?
The biggest change from my practice has actually been using the robot and doing operations. You know, for me...
Now, let's just take a second because people may not realize using a robot to perform operations.
Correct.
Many folks may not realize that, but we're actually using robots today to perform surgeries. Just in a very simplified way. What does that entail?
Well, it's basically almost like using a remote control car or remote control airplane, but it's specifically geared for us to do movements in the operating room. And it allows us to do very precise movements in a very confined space. And I mean, some of these operations we could do laparoscopically with our traditional instruments, but this allows us to do certain operations in a better way or a slightly different way that's a lot better off for the patient.
Is this a change that you will see accelerating, increasing in technology robotic surgeries, or is this a real special niche?
It's a specialized niche, and it will continue to grow. It will do both. Right now, it adds a little cost financially, which, of course, is going to get some pushback from the insurance companies and stuff like that. But as we go forward and we find more and more actual utilization for more and more specific operations, I think it'll become more and more a part. You know, everything's a tool. You know, you first came out of electricity, pretty much only light bulbs. Now you look, we use electricity for so much more. I think going forward, this is just, you know, tip of the iceberg, and we'll use it in so many different ways.
Talk about the robotic surgery from the patient's perspective. What are the patients telling you, and what are some of the benefits that they see in using robotic surgery methods?
Well, I'll speak on behalf of some of my urology colleagues. You know, the robot is absolutely phenomenal in the operation of taking out the prostate. So for prostate cancer, it's almost a must because you cannot do that operation laparoscopically without the robot. You can't do it safely. So this has allowed a whole new operation to basically done that you cannot do safely before. it's really helping out the OBGYNs, and they use it a lot as well. For me personally, I think a laparoscopic operation without the robot's a great operation, but what's even better is, you know, having young kids or anybody who's concerned about their body doing an operation where they can actually have, you know, just one tiny small incision instead of multiple ones. So that's been great as well. And I think as we go forth, we're going to find more and more of that.
How about actually utilizing the robot as a physician? Specialized training, specialized certifications required? What all's involved in getting yourself acclimated to that piece of technology versus your more traditional methods?
First of all, you know, being a surgeon, you need to be comfortable with the operation, period. After that, it's pretty much, there's a track that the company sets up where you have to go witness a case, and then you have to actually go to an animal lab. You have to work on things like that. And then in the hospital, we have, every hospital is a little different, but credentialing in the way of doing a certain amount of cases, being proctored, and just following a set pattern. And the good thing is it's kind of intuitive, which doesn't make it too hard, but like any operation, you really allowed to operate because you know what not to do, and when something goes wrong, how to take care of it more so than even doing it. So all of that goes together, how to use the robot without causing any harm and making sure you know everything to do.
What's your passion for medicine? What really fires you up about what you do, and have you been able to retain that, you know, 10, 20 years into your career?
I still have the feeling that it's an extremely noble profession. The thing, and
saving
I don't
lives,
know.
I'd say it's pretty noble.
I don't know how this is going to come off. Hopefully anybody watching this doesn't come off as conceited. But when somebody comes into your office, especially when they have a real bad problem, and they're basically going to hand their child, their spouse, or their parent, and basically say, "I'm trusting this life to you to help this person get better." And you know, I tell my patients this all the time. I tell anybody who know me, I am not God, not Jesus. I never claimed to be. I do not want their job. But I am a religious person. I think I'm being used as an instrument of God. So if I have the ability to help somebody out, I'm going to try to do that. And you know, with that is great. It's great to have a job like that. It's also very hard on you too if you do have somebody that doesn't do as well as you want them to. It's extremely hard. So if I say that's the greatest thing about being it, it's also the hardest thing about what I do, because if, you know, my patient doesn't do well, and you can ask my wife that, I have a hard time with that.
You know, it's inspirational to talk to you. I mean, it really is. We are so blessed in the community to have, you know, outstanding medical services, but also providers. And Dr. Jones, you're certainly one of them. Yeah. We're delighted to have you on Dollars and Cents.
Hey, thanks a lot.
Thanks for joining us.
Appreciate it.
All right, man.
All right.
When we return, we'll talk to a Parkland College graduate making her mark in the healthcare industry. Stay with us.
I'm Tammy Kesler, and I'm the director of the Computer Technology Center at Parkland College. We offer Microsoft application courses and keyboarding classes in an open entry, open exit format. It's set up to be as flexible and convenient for students as possible.
I was able to pick up a CTC class in the middle of the semester, complete it on time.
Doing that online allowed me to progress quickly and boost my GPA.
The CTC really helped me with Word. The instructors there were really helpful.
Welcome back to Dollars and Cents. Terrific conversation with Dr. Jones. We continue the conversation about healthcare through the eyes of and the experiences, frankly, of those who are actually practicing medicine, working in the profession in our local communities. To that end, I'm delighted to introduce you to Jennifer Compton. Jennifer Compton is just a terrific lady who is the Director of Cardiopulmonary Diagnostics at Provena Covenant Medical Center, but what makes her particularly unique for Dollars and Cents is you're a graduate of Parkland College.
Yes, I am.
Jennifer, welcome to Dollars and Cents.
Thank you for having me.
So talk about your experiences here at Parkland College and what's it like coming back, and welcome home.
Always love to come back to Parkland. I was a 1989 graduate of the respiratory therapy program and have stayed in the community since. I didn't grow up in Champaign-Urbana, but came for school. and have stayed since. Still have connections with Parkland through the respiratory therapy program and hosting students at our hospital.
Well, and many of you may recognize Jennifer because you're a bit of a media star as part of the campaign to promote, the life sciences program.
Yes.
Talk about that experience.
I was approached, one of my former professors and I were approached to do a ad campaign for Parkland College and just life sciences as one of those divisions, and was happy to do so because it helped to promote respiratory therapy, but also certainly Parkland College, which I had a great experience with.
Are you getting any feedback from your friends or people in the community about the ads? And
it's since kind of run its course, billboard-wise. Every now and then someone will say, "Oh my gosh, I recognize you." Yes, but
that's terrific. Well, you're a perfect example of why, the community college system works, quite frankly. You come in, it gets you ready to be employed, and you move right into the work world. Describe that experience, and did you have anxiety, and did you expect to get employed right away? Did you know that you were going to have a job right away? And for those kids out there that might be watching and contemplating, options for themselves, can you just kind of walk us through what that experience was like?
For me in respiratory therapy, at that time, they had students also work. So I got into the workforce before I even graduated from the program. So a semester before I graduated, I was working as a student. Some hospitals still afford that opportunity, others don't. Jobs are pretty guaranteed in healthcare. Continues to grow, continues to offer opportunities for so many. Sometimes it's just when does turnover happen? When do people move on to different things that the positions will open? Not always when someone graduates is one available, but healthcare, there's always going to be a job. For myself, went to Provena Covenant and have stayed put since then, so really had a great opportunity there.
A lot of folks talk about, shortage in nursing, there are jobs available in healthcare. You're working inside the industry and can give us a real perspective on those opportunities, and what are the challenges and the frustrations, frankly, with open positions and trying to keep full staff?
Well, one of the things that makes healthcare not for everyone, it's a 24/7, 365-day operation. We're not a bank. We don't close on holidays. We don't close on weekends. We're there all the time. So we have patients in beds. We have people to care for. That's not for everyone. We work night shift, we work evening shift, we may rotate shifts. Holidays are a big deal for people. Most people get holidays off. That's not our world. Those patients still rely on us to care for them all the time. So that's a challenge for some, and a challenge for getting some people into those positions.
As you see the healthcare industry today and the work that you do, compare it to what it was like when you entered the industry, and describe the changes that you've seen taking place, and what have those experiences been like?
Technology has driven the changes. Just in the 20-some years that I've been in the field, technology has changed tremendously, from simply not charting on a computer system to now being driven by our government to have shared charting and patient information no matter where we're at in our nation. It's called meaningful use, and we're driving towards that. All hospitals are. And it's fabulous, but it's a lot of work. As far as medical technology, advances in surgery, advances in care, just training in general, what we know about diseases now that we didn't know 20 years ago. So everyone's been forced to kind of learn as technology has advanced us, and it's allowed for us to take care of the patient so much better.
Drill into, cardiopulmonary diagnostics. Just what is that?
Well, I'm the director of what some might call ancillary departments. So they're not a nursing floor. They're support services. So the EKG department, the echo lab, the respiratory therapy department, cardiopulmonary diagnostics are some examples of the areas that I'm the director for. So they're the places that do the testing that the physicians order while a patient's in the hospital, or also on an outpatient basis.
What do you think about when you watch a news program or a presidential debate and the subject is health care, and affordable health care is a reality? The act was passed, it was upheld in the Supreme Court. What are some of the issues that come to your mind as the country kind of moves down this pathway of transformational change in the industry?
Certainly, it's just getting patients really access. Can our healthcare system handle this onslaught of everyone having an insurance and everyone's supposed to be able to be seen. Can we handle that in the Champaign-Urbana area? You know, I fully believe everyone should have the right to have health care, and it shouldn't matter on the ability to pay or not. That's just the nice thing to do for a human being. Fact is, it's still a business. We have to make money in order to be able to care for people. That's where the, you know, the kind of dichotomy is where's that break over? I like the concept, I just don't know how the concept's going to shake out.
And I'm not sure anybody does.
Exactly.
You know, but really, you're on the front line of helping manage through that change and help develop, you know, the care models that, frankly, are going to be the standard that we are going to see. From a macro perspective, I mean, do you see any of these changes starting to take place and things that you think might be coming down the road from a patient's perspective?
From a patient's perspective, certainly we're being forced or encouraged to work together more. Physicians, clinics, hospitals, working together for the patient. 10, 15 years ago, it was you do your thing, I'll do my thing, maybe we'll meet in the middle and hopefully the patient will get taken care of, and they did. But now the government's saying, we really need you all to work together in the best interest of the patient, which the patient has to come out ahead from that. So I really am very excited about that. It's in its infancy in the Champaign-Urbana area. I'm certainly starting to do some work with our clinic and the hospital in accountable care organizations where the docs are really having say on how the hospitals run, and then that quality outcomes impact our physicians as well.
We touched on that a little bit with Dr. Jones, and you know, it's kind of an interesting model that, you know, there are a number of models out there, but you know, in one model that the doctors don't actually work for the hospital.
Correct.
And getting them integrated with how to deliver care models can sometimes be a challenge, but partnering seems to make a lot of sense to deliver the quality care to the patient.
Yeah, they have to have buy-in into what goes on in the hospital, as well as we have to have buy-in into how they run their practice. If we don't have those together, then the patient still is in the middle and can often be, you know, I think, kind of left out, you know, after they're discharged from the hospital or prior to getting an appointment at the clinic. You know, if we plan together, here's the continuum of care we envision for our patient, the patient's going to get the best care possible.
If you take it back to, you know, the actual patient experience inside the hospital, the years that you've put into this, share with us a little bit of your passion for healthcare. You know, what is it about this industry that really inspires you, motivates you, keeps you coming back to work as motivated as you are?
It's the joy on the patient's face when they're better, or when they have had an open heart surgery and now can go walk again and not short of breath, or just come in with, in my world, an asthma exacerbation, and now they're better and they can go back to work. For so many of those patients, we provide that hope that in their chronic illnesses, sometimes don't think there is anything out there. I just enjoy the patients. I enjoy that interaction. You know, Champaign-Urbana is not such a huge community that you don't develop those relationships. Those patients that come back to our organization over and over become a part of your family. We're at the hospital often more, if not as much, as we're home. So you see another patient, it's like, you know, I'm sorry you're here, but we're here to take, you know, excellent care of you, and what can we do for you? So that to me gives me joy, and to teach that to others, that it's not about us, it's about making the patient's experience wonderful so they trust us in caring for them.
And what you're touching on, you know, is really, you know, the essence of what makes medicine successful. It's the procedures and the technology, but at the end of the day, you know, there's a big relationship component to what we do as well. And, you know, how strong is that piece of the overall wellness or healthcare delivery? How strong is that remaining in healthcare, you think?
I think it's huge. Patients expect us to be technically excellent, have the best technology, be book smart. They expect that from us. The cherry on the top is the relationship. You know, seeing a physician build that relationship with a patient when they walk into a room and sit down at the side of a bed and say, you know, Paul, I'm here to help you. Tell me about what's going on. Why are you here today? And that patient trusting the physician so that they give them the whole story. They don't give them the whole story, we can't treat them completely. And some patients don't feel that trust initially, and we have to build that. Sometimes the trust is built through the nursing staff or other staff that care for the patient at the hospital, and then can be transitioned to the physician by us telling the physician the story. So it's a collaborative effort. It's not just one individual doing all the work.
What do you tell a young person contemplating their next option in their career or thinking about career options? What would you advise them in terms of the healthcare profession?
I've had the opportunity to speak at one of our high schools here in town about health careers and my profession as a respiratory therapist, and we'll ask, who are my math and science lovers? Who is my person who does not like people? Then you don't want health care, because that's what we deal with. We deal with service. It's not much different from being a waitress or being, in the hotel service. We're here to serve others, and if you don't have that in your heart, you're going to have a difficult time with the job, because it takes giving of yourself to total strangers in often cases that makes that experience wonderful.
If you have that inherent ability and you love people and you feel that you have a service mentality, then what are some baby steps that you would suggest people take or contemplate, just to expose themselves to maybe the healthcare industry?
Volunteering is a great way to get them into the hospital. As a matter of fact, as I left the hospital today, on the floor that I left, there were many volunteers, and many of them are U of I students. Some are even high school students that think maybe they want to be a nurse, or think maybe they want to be a physician and just want to get kind of an idea of what goes on. That's the first exposure that is fabulous for so many individuals. Others are just taking some general education courses in a biology or in a science area, a math kind of prerequisite stuff to see where does that take me and does that really excite me. Shadowing, if you're offered the opportunity to shadow someone on a job, that's a great way to see how's their day-to-day go. Those are some real wonderful ways to see if that's really what I want to do or if it's not necessarily what I thought.
Terrific suggestions as well. And then just back to Parkland to wrap it up, was the college experience, describe the experience in terms of preparing you to move into the workforce, and what do you recall about your experience as a student here to get you ready for a healthcare career?
I remember Parkland preparing us fabulously. Not only did we have classroom stuff, we had labs that were here at Parkland, and then we had clinics. So in my day, we went to Carl Hospital, Covenant, Burnham was still around then, so we went to all 3 clinic sites. So you got exposed to a whole lot of different things, so that by the time you graduated from the program, you were ready at that entry level. Now, you weren't top-notch therapist that was going to go out and save the world. You had a lot to learn, but you could go do your job. Nice. And that's what I think Parkland really does such a fabulous job about, especially, from my experience in the life sciences, is they prepare you for a national board exam. And that's what all of us have to go take to be able to get a license to practice in our field, is a national board. So they function off of kind of a hierarchy of knowledge that here are the things that we need to teach that would prepare you for that national board, and they do an amazing job.
Can you see yourself doing anything else?
Not outside of healthcare. No, I really can't, and knew nothing about it when I got into it, but really feel it was what I was meant to do. I had always told my father I wanted to be a teacher. He said, "They don't make enough money." I teach every day, just in a different way. Not children in a school, patients in a hospital. So I still get to give of myself and give that knowledge in a different way than I ever thought I would.
I think people are going to feel that when they hear that from you. Jennifer, thank you
for
spending some time on Dollars and Cents. Thanks. Jennifer Compton, we will be right back.
I felt like I wanted to be more involved in the school activities at Parkland. And I knew a friend that was in Club Latino. You meet a lot of new people.
We just go to different schools to encourage them to consider college.
This club was actually highly involved in Parkland College, Abre las puertas a tu familia. This club did translating, greeting, and taking families on tours. But it's also about having a place to hang out with each other.
Welcome back. I want to thank Dr. Jones and Jennifer Compton as our guests for this edition of Dollars and Cents, focused on the healthcare industry. Folks, we're all in this game as the industry goes through transformational change driven by the Affordable Care Act and technology and and everything else that we're facing. So we thought that it would be interesting to provide some insight from some professionals that are working inside that industry in our community every day and delivering outstanding care. So thank you to those two as our guests. Thanks again, of course, to Chris Foster and Mike Coulter as the director and producer of Dollars and Cents, and of course to Parkland College for the opportunity to present to you this edition of Dollars and Cents. Thanks for joining us.